was in Mali in 2007 on a Fulbright scholarship, and it was really in that year that we began to understand why time mattered so intimately.
Because we'd found ourselves at ground zero of this global crisis in maternal and child mortality that kills more than 5 million children every year.
I will never forget sitting with one of my neighbors. I noticed that somebody in her broader family compound had a young infant, and that the infant was breathing rapidly, covered in sweat. Her little one had been sick for about a week. We rushed her to the local health center, and it was too late. And her little one died on the exam table shortly after the child was diagnosed with malaria.
That first year, we were at funerals of babies, of kids, of young moms, nearly every week. Kids who are dying mainly of diseases we've known how to cure for decades.
Most cases of malaria are curable with about $1 worth of medication, but waiting even a week can be catastrophic.
The problem wasn't about a specific disease. It was about the distance that they couldn't travel, the childcare that they couldn't afford to pay for. It was about not getting the care they needed on time. It was about delay.
Musa really came out of that. So what we tried to do was systematically identify all the different roadblocks to care access, and then we tried to remove them.
And we built a new kind of health system that meets patients where they are and where they need care, rather than asking patients to show up at the door of a facility.
We hired 20 people to work as community health workers and to do this proactive door-to-door active case finding, looking for cases of illness in Uri Majo, and then being a bridge to the rest of the health system.
Today, Muso serves more than 370,000 patients across 2 different regions of Mali.
Community health workers visit every household in their community at least twice per month. They live in the communities that they serve. So it's 2 o'clock in the morning and your child has a high fever, and you can send your teenager down the block and she's ready for you. And she can do some triage and figure out what needs to happen in the middle of the night. And even when communities are off the grid, the proximity makes all the difference.
Well, you know why I'm calling you guys. Congratulations, you won the prize.
What?
Yeah, you won the prize.
To receive the news that we were going to join the Bronfman Prize community, it was particularly moving to us because our Jewish practice has brought us into this work, and it sustains us through this work.
Tzedek, tzedek tirdaf. Justice, justice, pursue it. And tirdaf, you must do it. And I think that when we encounter injustices, it feels like an imperative. Because ultimately, this is not a story about Mali. This is a story about our world and what is possible.